All right. Hello, hello. Welcome back for our day three of the 4-day thyroid and hormone workshop reset. We are going to be I'm super jazzed about what we have on store today because today is diving into some more of the brain science around how we can actually help to reprogram our nervous system. And as we talked about before, what's happening, our thoughts and our perceptions are like kind of that top of that funnel that signals to the rest of the body how our hormones are going to respond and how we can charge up our energy or whether or not we feel, exhausted and overwhelmed and just completely like not having an ability to concentrate. Yeah, good to be here. It's so great to be with you as well. So excited. And feel free to pop into the chat. If you're just tuning in, feel free to pop into the chat. Like, what's a new aha or a win or something that we can celebrate so far that has happened this week, whether it be looking at PFFV, protein, fiber, healthy fats, vegetables. We talked about replenishing nutrients on Monday. Yesterday, we were talking about digestion and the importance of really being able to be present and to slow down and how to look for signs to test your digestion. Yeah, digestion. Okay, so digestion, really thinking about how to slow down is a big one for a lot of us too. You are definitely not alone. Um, Anything else that has come up with regards to thinking about the liver health and all the nutrients that your liver needs just to be able to produce different hormones that we talked about on Monday. That's important as well. But today we're going to, like I said, we're going to be diving in deeper into some of the brain science around resetting your thinking because so much happens in automatic patterns with how we interpret and make meaning of different situations in life. So without further ado, let's dive in and get started. Here we go. So we are doing portion screen. There we go. Should be all set. Can you see our slides? Good. Okay. So like I said, this is our day 3 of 4 days. Tomorrow we're going to be wrapping up and we have moved through a lot already. So we have been talking about how to first identify the root cause and recognize that ultimately healing the body means we get to spend more time in parasympathetic activation, right? Have this beautiful balance between sympathetic, which is the fight or flight, freeze aspect of our nervous system, and parasympathetic is the rest, digest, heal, repair aspect. So when we think about the root causes, putting together some of the puzzle pieces and saying, what's going on with my symptoms? What are my symptoms signaling to me through the hormone assessment? And how can I start to put the puzzle pieces all out on the table and lay them out and then start to make sense of the picture here. We also talked about on Monday the importance of getting nutrients in. Every single day, every single cell needs different vitamins and different minerals and antioxidants in order to do its job as designed. So having a steady, consistent supply using that simple PFFV framework is really important. And then yesterday we talked about restoring digestive fire, increasing the strength of your digestive capacity and your gut microbiome health, so that as things are moving into the digestive tract and moving through your gut, you're able to utilize those nutrients effectively and to absorb. And so that was kind of diving deeper into the gut health and the microbiome and the effect of our gut health on hormone levels. We talked about how we can have excess estrogen because of some of the balance of our microbiome of what's happening and different things like that. And today we're diving into step number 4, which is all about reset your thinking and how your thoughts and your perceptions are shaping a lot. Like I said, we've covered a lot. We've talked about identifying the root cause with the hormone signals, seeing which of those top 6 metabolic hormones are showing up through your symptoms to say, hey, pay attention over here. I may be needing some support and some help when you take the hormone assessment. We also talked about increasing your confidence and how to nourish your cells easily and consistently. And actually, you know what? Give me a moment. I'm going to pop. I realize I did not do it yet. I'm going to pop here into the chat. The workbook, again, as a reminder, if you can tune into day 3, we start on page 39 of the workbook. Moving on, we talked about improving your digestion And we also looked at some of those unconscious blocks that get in the way, right? When we fall into that why bother syndrome and we think about like, oh, I've tried this out before, or I've worked with a functional medicine doctor, or I've taken supplements and it still didn't work for my body. We get to identify and see those blocks and then step into that new alter ego version of ourselves. Like, who do we get to embody and practice being and thinking and feeling and behaving, and what are the skills that are necessary for the version of you that has the health that you desire, right? That feels truly vibrant with energy every day. You feel mentally clear and focused. You feel calm and grounded and patient when you're having conversations with loved ones or even family members that have driven you crazy for years. It's like, okay, you can have a new threshold and a new level of acceptance and unconditional love and patience, because that's actually a capacity that you have. Now we're going to be talking about rewiring your brain for those consistent practices of these behaviors. Because ultimately, anything health is doing one or two things, like a handful of things, maybe three things at most, but doing those things hundreds of times is not doing hundreds of things one or two times, right? It's how well can we consistently do these practices, and that's really what's going to build health. So today it's about resetting your thinking and going back to why this is so important, because ultimately your decisions at the end of the day are what build your health. And when we think about this axis of connection with our hormones, we start at the top, the hypothalamus, our thoughts, our beliefs, our perceptions, our expectations about the way that the world is, the way that our body is, the way that life is for us, right? That signals to the pituitary with your internal environment. If your internal environment is one that is calm, balanced, relaxed, it's going to signal very differently than if it's one that feels not enough, you don't have what you need, and there's danger, right? Then that signals to the adrenals for our stress and immune control, and eventually signals to the thyroid, which helps to regulate your metabolism, and it gives that signal of, should I be storing fat because I don't know when I'm going to have enough energy for the future, or is everything a-okay? I've got an abundant supply of nutrients that I need. I have adequate ability to generate energy with my cells, right? This is all starting with what's at the top. And again, the reason I share this and go back to this, because life is about this quote, life is 10% of what happens to you and about 90% of how you react to it, right? It's much more about our perceptions, our reactions, than it is about the actual circumstance. But let's be honest, when you are in your life and you're thinking about like whether or not you intentionally nourish yourself with 3 meals a day that have protein, fiber, healthy fat, and vegetable or not, whether you get up and have that consistent exercise practice, maybe building in strength training. I love on YouTube, there's like all these trends where they're showing like people that are in their 90s that are still lifting like really heavy weights, or a woman who like set a new world record for being 103 and running a 50-yard dash. Like, it's the new normal, is that any age can truly be healthy and active and strong and mobile. So whether or not we take mindfulness breaks throughout our day or not, whether we demonstrate self-love and patience and unconditional acceptance or don't, and judge and criticize ourselves, this comes down to our thoughts and our beliefs, right? So that's why it is so much more than just willing yourself or taking action. And really amazing transformation is possible. I always come back to like give you inspiration to see what's possible. Just like Debbie, who lowered her blood pressure, lost 8 inches, added more clients to her practice. Another client, this was Susie, who officially lost 25 pounds, planning her weeks, thinking about vitamin C and iron after we did her micronutrient test. She knew what her body needed more of. And she's excited to talk to her doctor about what we discussed and the information you gave me, like thinking about, she's now more empowered. So she's a collaborator when she went into her annual checkup, as opposed to just tell me what's wrong, everything's fine, or I needed another medication for my cholesterol, right? Then we are going to talk about how really, really amazing your brain is. I like to hopefully inspire you with some awe and some appreciation of your body because it is so beautiful and complex and intricate. And our brain has 100 billion neurons, which are bathed in soup of hundreds of chemicals, including neurotransmitters and hormones, and all sorts of different activity is taking place. And the brain is capable of processing an average of 11 million pieces of data every single second. So think about this. This is 11 million pieces of information, 11 million more pieces of information. 11 million, I mean, it's so much that it's processing. Like right now, you're probably listening to my voice, maybe reading the things on these slides, but you may not be consciously tuned into the feeling of the pants rubbing next to your skin, your leg, or the sensation of your heart beating and feeling that, right? Those things happen all the time, whether we're putting our attention there or not. And this is what the distinction is. Like we're only consciously tuned into or paying attention to about 40 things every second. But the brain is processing so much more every single second of every single day that you're alive. So your consciousness is only a tiny little fraction of that. So why does that matter? Well, when you think about, again, going back to this data, right? When we think about there's so much information happening and so much potential to be knowledgeable of at every single second of the day, but our brain is only tuning into a tiny, tiny little fraction of it, 40 pieces of those 11 million every second. So when we think about our world, what we believe, what we expect, what we make sense of, or the meaning we give to situations, the world that we're perceiving is only a tiny, tiny, tiny little subset fraction of the whole picture. This means that the people, the circumstances, the situations, the events, as you understand them to be, are more significantly about what you expect to experience, rather than that's the whole and complete truth or the whole and complete picture, right? Because I said, we're only tuned into a tiny little fraction of the picture with those 40 million pieces out of 11 million, or 40 pieces out of 11 million every single second. So when we think about, do I believe that it's hard for me to lose weight? Well, yeah, the part you focus on maybe does, because maybe that's the part you've been tuned into, but there's a whole other aspect of your body and your body's neurology and your body's metabolism and all the different things that could potentially tap into and make it easy for you to release weight, right? So when we think about managing our emotional state and how we think about things, or what our beliefs are, what our expectations are, this is one of the cycles that happens very regularly, very common. Again, no judgment. I've been here and I've lived this for so many years when I was especially really struggling with my own health. We have a situation that comes up and we're reacting to it, right? It's not responding consciously, it's just a reaction that happens, which usually creates some type of negative emotion. And that leads to that signal in the body through that hormone cascade of physiological stress response. It turns on the fight or flight response. It cranks up the nervous system and says, whoa, 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 Houston, there's a problem here. We need to be prepared to save our lives. And this decreases your overall hormone function. It decreases the level of estrogen and progesterone and testosterone. It decreases the level of thyroid hormone that can be available to be used elsewhere, because instead it's going to prioritize adrenaline and cortisol to respond to this perceived threat. That leads us to exhaustion, which then makes it easier to react again for the next circumstance, the next conversation, the next situation. This is when your environment is controlling you. You essentially have gotten into that depletion loop, and it feels very, very unmanageable and overwhelming. What we want to do is help you get into a situation where you're feeling, I went too far, where you are feeling like you're managing your emotional state. You can manage your response to your environment. So even if a situation happens where, you know what, you stepped on the scale and you didn't see a number that you wanted, okay, I can take a deep breath. I don't have to get super defeated. I can take a deep breath and just be like, interesting, I wonder, what can I know about my body? If my body is infinitely intelligent and it's holding on to weight because it's perceiving that it may need this energy at some point in the future, I wonder why. Like, I wonder what signal I gave it to want to hold on to the weight instead of thinking like, oh yeah, I get plenty of nutrients every single time I need them. I can release that weight. And so how we respond with curiosity, how we respond with patience, right? That's a different emotional set point, which then gives the physiological signal to our hormones of, okay, yeah, I can be in curiosity mode, rebuild, create, restore, repair, which increases that hormone function, allows you to feel energized and maybe even optimistic about what's possible. You have a new distinction that you learned about your body. So now you have clarity, and then that allows you to respond the next time in your body. So you can see how the cycle goes, either kind of spirals up or spirals down, depending on where you're at with your thoughts and your emotions. And I like to think about it this way. When we think about reaching your health goals, I can't tell you how many women have come to me after working with nutritionists, working with functional medicine doctors, working with other practitioners, and they've been so focused on trying to take a lot of action to reach the result, the goal that they want for their health. Maybe their goal is to get off their anxiety medication, or maybe their goal is to, like I said, have balanced moods where they feel really good. Maybe their goal is to improve their gut health so they don't have to like worry about like digestion and bloating and just feeling really sick many days where they don't even want to like go out and do things, right? That's the result that is desired. So the action that they're taking is trying to start with like a whole bunch of supplements or really rigid elimination diets or things like that. But what they haven't done is go back far enough in this process to really get to the root cause driver, because our actions, our consistency and the effectiveness of the action is always going to be preceded by the thought. What are our beliefs? What are our thoughts and our expectations about that action? Do we enjoy taking that action? Do we appreciate that we get to take that action? Or are we resentful of having to do this action and feels like really hard work? Well, what precedes the thoughts is our emotion around it. Do we feel confident? Do we feel optimistic that this is really supporting my body? I understand why my cells need some more vitamin A and some more B vitamins. So I'm happy to eat this nutrient dense food. I'm happy to make a beautiful rainbow salad and maybe some steamed spinach with my breakfast because I know how valuable this is, right? That's a totally different emotional response than, oh, I don't want to make, or I don't have time type of thing. And again, no judgment here. It's just about awareness. And what allows us to more frequently respond with positive or even curious and hopeful emotions is our nervous system set point. So that's why we're talking about today, rewiring the brain and knowing what is your nervous system's capacity, right? How can you tolerate different circumstances in your life? So this is how you reach your health goals. A lot of people think I have to do certain things and then I can have the health that I want. What I have found in working with hundreds of clients is that actually we get to go a step before that. And it starts with being. Who are you being? This includes things like rewiring your nervous system, doing the identity work that we started to do a little bit of yesterday, that alter ego, like what are my thoughts? What are my beliefs? What are my supports? What are my skills? What are my habits? Right? Doing the emotional work. A lot of that is emotional metabolisms. A lot of we've had lived experiences that were really hard or that gave us reason to believe that being healthy is hard. And no one's denying that, but it's also important to be seen and to be witnessed and to be able to emotionally metabolize some of the challenge and the trauma that you've gone through. We picked up things from our society too. I told you, I picked up a lot of beliefs and expectations from my culture, from my parents, from just what I witnessed around me and other colleagues and friends. And so I had no idea until I actually start to had someone, mentor me through how to look at these things and how to start to shift them, upgrading your beliefs about what's possible for you, right? So we get to do that piece first and then pair that with the doing, learning new skills like meal planning, right? using your chat GPT prompts to really make it streamlined and organized to get consistent meals, having the right supplement fit for your body, perhaps doing micronutrient testing and knowing what does your body actually need now, instead of guessing or Googling and hoping that you feel better, right? Getting in good exercise and sleep and vitamin J, I call vitamin J joy, and then practicing those hundreds of times. That's the consistency piece. When you are being a version of yourself that is optimistic, that is informed, that's clear, that feels confident, it's easy to do these healthy habits consistently hundreds of times. And that's when you have vibrant health. That's when you reap the benefit of having good health. First, by being the kind of person who has the clarity, the confidence, the desire, and then doing those things consistently, even when life throws you a curveball. So when you think about reaching your health goals, again, your nervous system has a range of regulation, or like I like to think there's a range of tolerance or range of capacity. So it means you can probably do a lot of healthy choices. Like if everyone knows, if I eat real whole foods, if I move my body, if I get good sleep, if I give myself breaks for self-care and to like, kind of bring my nervous system down, meditation for some, prayer for some, just even going outside for a walk, giving yourself some built-in recovery breaks. If you do those 4 things, your health will be strong, right? This is not rocket science. The problem is we usually don't do those things consistently enough or have the right distinction for what our body needs now. And then life throws us a curveball. So we get out of range and we don't have the ability to respond to our environment, to life with conscious agency or choice. So now you're reacting. And now you're going into that hormone cascade, that loop that starts to go a downward spiral, right? So what we get to do is we get to update our nervous system set point through signaling to our bodies that we are safe, even when we are experiencing something that feels unfamiliar, something that in the past would have sent us out of our capacity to handle calmly. A prime example for a lot of my clients is if they step on their goal is to lose weight and they step on the scale and the number hasn't changed, or worse, it's gone up, that throws them all out of capacity. Like how to be able to, you actually can create sustainable momentum when you respond to the same situation with a new perspective and a new curiosity. You learn from it, you grow from it, you understand and work with your body instead of blame, shame, and guilt yourself. Right? It's counterintuitive, but that's the fastest way and the easiest way to actually lose weight is to not freak out when the number on the scale doesn't change, because you learn from it. You now have more clarity and more distinctions. So here are some signs to know if your nervous system is dysregulated. It can be hyper or hypo when it comes to our health. So when you're regulated, you're nice and balanced, you're thinking clearly, you're calm, you're centered, you're poised. When you're dysregulated, it can look like you're chasing the merry-go-round of diets, trying another quick fix, always busy, or feeling anxious, overstimulated. Maybe you're super diligent about your workouts, like cannot miss a workout. You're super like dogmatic about it and almost get panicked if something's going to throw your schedule off. You are compulsive or mindlessly eating. Maybe you're hyper aware or even scared of certain foods because you're like, oh my gosh, I have a reaction, it doesn't work well with me. And it's like you're almost like super strict with foods. You're trying to do it all, trying to do meditation and therapy and supplements and doctors and all the things, and it's still not working. Probably because your nervous system is in overdrive. You're Googling everything. You feel like there's never enough time in your life. You can never get everything in and done that you want to do. You jump into more action or you have trouble staying focused. So can anyone relate to this hyper responsive side of the nervous system? Because that has been me. I've been both of these before. Yeah, Alexa's saying yes, definitely. Okay, you can relate to this. Well, first of all, I just want you to know you're not alone. This is very, very common when we just have dysregulation, right? This is the hypo side of the dysregulation in the nervous system. This is where we're like almost like, oh, can't get started. We avoid doing meal. It just feels overwhelming. hard to get started with exercise routine. I don't follow through on what I know would be helpful. I know that this would be good for me to do, but I just don't follow through. I'm feeling chronically overwhelmed. I procrastinate, put it off. I'll do it later. I'll do it later. I'll get to it next week. Veg out on Netflix. Or use food to soothe. Like sometimes food can be a very big pacifier, right? Feeling depressed, down, lethargic, disconnected from your body's needs. Like you're not even noticing and paying attention to what your body is trying to communicate to you, and putting everyone else's needs before your own. That's another sign of being hypo-responsive and neglectful of your self-care. Is like always when things come up from someone else in life, it's like, oh, well, my son or daughter needs this, my husband needs this, my mother needs this, my aunt needs this. And it's like, okay, well, where do you fit in the picture? That can be a sign of hypo-responsive. Portia saying yes, totally makes sense. So I just want to kind of pause here and say, because we get to, again, build awareness, right? Which one, Stacy, Joanne, do you feel like you fall in either one of these camps, or neither one? I'm just curious, as we're thinking about the nervous system.
I vacillate.
Yeah, Joanne, you vacillate. Okay. You kind of go back and forth.
Mostly hyper.
Mostly hyper. Okay. I got that. Stacy, I think you were trying to unmute. Are you able to share which way did you feel like you find that you lean?
I think the same thing. I mean, sometimes is hyper and then sometimes is hypo, but mostly I'm more hyper than not. I stay busy.
Stay busy. Okay. Yeah, I feel like I can relate to a lot of it. A lot of us. I definitely vacillate between, but I think it's like I would be hyper, hyper, hyper until I would just like crash. And then I would just be like hypo for a little bit, and then almost like hyper, 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 and then crash. So a lot of it is like, what can we do to be using, doing some of the inner work as well for the nervous system to give you more range of, I think about it as like widening your river, right? If your river is like, okay, I can keep things going when life is all smooth and steady and here. What we want to do is give you the capacity to still maintain your health and still keep those practices that are long-term important, even when life has got a lot of twists and turns and bumps that you didn't expect, right? When we can do that or still respond with, um, presence and acceptance and creativity of like, how can I make the, it's not necessarily just always giving yourself a pass of like, oh, well, life is a little bit challenging, so I'm just not going to do my exercise routine and it's okay. It's not just always that. Sometimes it's like, well, okay, I know it's important for me to get outside and get some fresh air and move. So maybe instead of doing my 45-minute walk, I'm going to go for 15 minutes today because something else is requiring my attention. But it's like, it's finding ways to get really creative and adaptive and respond intentionally, over and over and over. So good. All right, let's continue on. Thank you, ladies, for sharing. And here's like a little self, and again, this is I can put the workbook in the chat one more time because I know some people chimed in a little bit late, but here's the workbook. And this self-check is on page 41. So when you think about your nervous system, your emotions, your thoughts, your beliefs, what's at the top of that hormone cascade, right? The HPAT axis. More often than not, would you say that you feel protected when it comes to your health and your life? Like you're kind of a little bit more anxious or worried or hesitant or fearful? Or do you feel expansive, interested, curious, excited, ready for new things and wanting to like just explore and that kind of creative aspect? Which are you in? No wrong or right, just awareness. Now, the next side of your baseline, when it comes to the way you manage your health, I fall more into the category of cat or systematize. When I think about managing health, this is the actions that you're taking day in and day out when it comes to your food and how you're planning and cooking and nourishing yourself, when it comes to your movement, when it comes to your sleep, when it comes to your, kind of self-care, stress management type thing. Do you have a clear systematized approach to that and it works and it's seamless for you, or is it pretty chaotic? Like sometimes I do well, sometimes I totally, everything gets thrown out the window, right? And then finally, when it comes to my health and your physical symptoms, I generally experience discouragement. I feel just kind of down and like, oh, why can't I feel good? Or you experience vitality. You feel energized, you feel great. So when we think about this, you can fill in the first letter of each, P or E for the being. It's kind of the nervous system, your internal identity, how you're focused. The doing is kind of that C or that S. I'm chaotic, it's random, haphazard, or it's very systematized and organized. And then the have, this is what it's kind of the result, right? Do you have a lot of discouragement when it comes to your health or a lot of vitality? And this is what I tend to think of when we think of our empowered health leader, being a leader of your health. You get to kind of put those three initials together and see where you fall in this pyramid. Are you somebody who has a lot of expansive, exciting, creative, optimistic thoughts about your health? You're very systematized with how your routine is and what your daily and weekly health promoting habits are, and you feel vibrant. You have a lot of vitality in your health. Or, that's the top of the pyramid. Or maybe you're somewhere in between with one or two of these things that are, maybe you're very, expansive and optimistic, but you're pretty chaotic when it comes to the actual implementation of things, right? Or maybe somewhere else in the bottom. So can you put into the chat, if you're willing to share, just what three initials came up for you when you did this pyramid? PSV. So protective, systematized, and vibrant. Okay, good. Alexa, PSV. Okay, so that's like that's an emerging health leader, right? So you're definitely taking steps. You're definitely aware of what are some opportunities. And it sounds for you, it's really doing some of the more of the inner work, more of the nervous system, the brain science, calming the body down. Who else? Who else wants to share? Yeah, makes sense. Who else wants to share what came up for you? PSD. Okay, so this is protective, systematized, and discouraged. Okay, so Joanne, so again, kind of right there, you've got some good systems going, but it sounds like maybe some more of the nervous system aspect is going to allow your body to reap the benefits of the systematized work that you're doing. So it sounds like you're probably doing a lot of good things, taking action, but until we do that deeper root work, it may not be getting the full results that you're seeking. So yeah, anyone else want to put in their kind of 3 letters to see where you're at? Does this make sense? Okay. Cool. So what are some of the tools? When we think about the tools of support. So if you're looking at that protective mode, this is more of the being. And okay, so Portia says also PSD. Okay, so this is the being. And this is where, again, this was a piece that I did not do in the beginning because I was just working with a naturopathic doctor and a nutritionist, and I was doing so much stuff, especially when my daughter started having seizures. I was doing all of the doing, a lot of the meal planning and the sleep hygiene and all the things like that. And I had no idea because no one had really talked to me about brain science and rewiring and giving light to the struggles. Journaling to see the patterns, really using some different tools and techniques that we use with our clients to help them make it easier to see a new perspective, to rewire their thoughts, their beliefs, their perceptions, and really have this nervous system calm down and release, right? Sensory visualization, using EFT tapping is one of my favorite techniques that we use with clients too. There's a lot of tools here that can help to support the nervous system so that you have more capacity and more bandwidth. If it's more about the systematized, for some of us, it's like, hey, I really don't have good systems in place. So I need to have some ways to streamline, to organize, and to prioritize 3-2-1 evening routine. That's something I teach about how to optimize sleep, taking customized supplements, knowing what your body needs now. That's not just kind of randomly guessing. Eating hygiene, we talked about slowing down, being present for meals, chewing thoroughly, right? These are all the tactics, the actions, but the way that we do those effectively can first dictate what the being part of it is. So I do like to think about, like, every single person is unique. And you can certainly gain insight from experts and doctors and specialists, yet the most important aspect of health is to know yourself. Knowing yourself and knowing how your body responds, what your body needs, takes curiosity, it takes focus, and I think it takes a step-by-step plan. This is what I found working with so many women. It takes a step-by-step plan to help you kind of learn more about yourself and your body and move past the overwhelm to take that consistent action so that you do reap the benefits of having good health. So as I'm stopping here, I just want to share, does anyone have some new ahas about what is it that stands out for you? That's that next needle mover. That's really going to change the game in your results and help you to reach your health goals. Who wants to maybe unmute or type into the chat of, like, what's standing out for you right now? Putting you ladies on the spot. Anyone?
I think changing your mindset is the most important thing, because how you see yourself and it's going to determine the actions that you take. So I really like looking at yourself as a super hero, or this is the way you look at yourself. If you look at yourself like I can't do it, or I'm having problems, instead of I can do it, then I think that makes a difference. So I really like changing the mindset.
Yes, Stacy, absolutely. It's the inner work. It's the deeper identity work and the inner, and that goes in conjunction with what we talked about yesterday, this formula of desire plus non-resistance equals your experience. And a lot of times the inner work means we get to release a lot of that past kind of built up gunk, the emotional trauma, the lived experiences that we've had from our past, and just finding a way to allow that to be released and to be understood from a new vantage point and a new lens, and give yourself compassion and self-love. And that's, like I said, so much of the work that I do with clients is that part, because that part is what makes everything else tremendously more effective. Because if we're not getting out of fight or flight response because of the way we're thinking about our own self or about others, and judging and criticizing and blaming and shaming and worrying, the rest of the benefit of, like, the food that you're taking or even the movement that you're doing, it's just all hampered. It's mitigated. You're not going to get the full benefit of it, if you will. So yes, thank you for sharing that. And Alexa says the same, mental work, being curious instead of critical. That is so important. So would you ladies like to learn, who here is interested to learn a little bit more about how I help clients to do these things consistently? Is anyone interested in hearing? Yeah, Joanne's like, yes, definitely. Stacey, yeah, definitely. Okay, well, let me share so you can know a little bit more about, this is how it's possible to get these kind of results, so that you're not relying on symptom management, which is definitely not adequate for a long-term sustainable hormone health. We talked about this. So, like, hormones start at what's happening at the very top of that funnel. And if we're not changing that, it's going to be this perpetual cycle. That's disease care. That's not health care. So creating a predictable process for living with vibrant. Honestly, I think the solution is to partner with somebody, to look at having a mentor, somebody who's done it for themselves and helped other women to do the same process. So you're not trying to recreate the wheel and guess. So imagine if you have ongoing clarity, confidence, guidance, and inspiration to take consistent action. This is how you can massively charge up your energy, sleep better, and feel refreshed, feel eager, clear, and peaceful, find that spark in your life again, and increase your health in all areas. The benefits of naturally balancing your hormones are to boost your energy and your productivity and your focus, enjoy deep sleep, wake up feeling energized and refreshed, expand your health in all areas of life. Like I said, your health affects everything, how you show up in relationships, how you show up in work, how you show up in everything in your life. And really sweet, that's like the natural consequence when these other things are in place, right? So this is how the program, the Thyroid Hormone Solution program, will work for you. Month one, it's a 5-month program, mentorship to partner together. I get in the trenches with my clients and really collaborate so that you have guidance step by step. Month one is all about really understanding your body and where it is now. So it's not generic health information, it's not just standard protocols. It's really about looking at your symptoms, your hormones, your nutrients, and where your body is now so that we can be more strategic and streamlined in where we focus and what it needs. The con, if you don't have this kind of customization, is that you lack clarity, and chances are you're kind of guessing. It's like throwing spaghetti at the wall, which increases the results of kind of giving up and just saying, I don't even know if I'm doing the right thing or if this is having any change at all in my body. So that definitely is not going to create that lasting result if we give up. Then in month two, it's all about creating that simple, sustainable way to easily find meals that work for your body and your life. The con, if you don't have this, is you can kind of get really stuck with an unhealthy relationship with foods. You know, I've worked with so many women who previously have had rigid elimination diets, meal plans that were just not sustainable and massively overwhelming. So it created more shame, more guilt, and more blame, which, as we know from a nervous system perspective, is defeating the purpose. It creates an unhealthy relationship with food. So this is all about working with you and building and stacking wins and momentum and simplicity so that your body is starting to see the benefit and the response. Month three is where we do a deeper dive in your gut health, just like we talked about digestion. Gut health is the foundation of all health and has a far greater impact on your mood and your energy and your vitality. The con, if you don't have this, if you don't have somebody kind of guiding you through how to have good, strong gut health, is that you perhaps are not going to likely digest the nutrients that you need. So even if you choose those healthy foods, you can still feel depleted and defeated. Again, month four, we're all about making the connection with how your perception affects your hormone health, what we were starting to do today, rewire your brain, allow that space to get into curiosity, to get into creativity, to see the new perspective and easily experience contentment, peace, and appreciation. If we make it so much easier for you day by day to feel content, to feel appreciation, to feel peace, that's every single minute that your nervous system is in healing mode. So the con, if you don't have this, it's like imposter syndrome. You know, your new challenges and trusting yourself. Like I've got this new diet, I'm trying it, but I don't trust myself because I haven't done it before, right? You won't stick with the healthy habits. And this is where you need to go in order to create permanent transformation and really get to the root. And then obviously we do some more focus on getting what I call like a master level way of balancing the toxic threshold. Everybody has a total toxic threshold that it can maintain and can use our liver and our kidneys to remove and to keep up with, and it kind of keeps humming along at a good pace. The problem is when we have too much toxins and not enough like nutrients and or hormones to balance, to maintain that balance. So we're going to talk about this a little bit more, but if you don't have these clean living strategies and ways to minimize triggers and maybe emotional triggers, right? Where if you have, like I used to say this phrase to my daughter, Taylor, she'd be like, oh, Avery always pushes my buttons. And I was like, yeah, that's true, but maybe don't have so many buttons out there that are easy for her to push, where it's so quick and easy for you to get triggered emotionally, right? So we want to make it easier for you to have that calm and that contentment where people can say things or do things and you're like, oh, okay, that's them. It's nothing to do with me. It doesn't bother you. If we can decrease those triggers and clean up some of the physiological toxins in your body, then your mind and your body do not become overwhelmed and inflamed, which lead to depletion and blockage. And that's what causes chronic disease. So that I actually do the detox as the last step. A lot of people start with that. And I'm like, we want to be coming from a place of strength so that that detox is like long-term supportive and sustainable. So if you think about doing this on your own, here's what I suggest that you need. A lot of different things, right? A unique health history, look at your body specifically. Symptom review, functional lab work to know what's going on in your body now. Nutrient coach to help you really come up with some simple meals that are going to be sustainable and effective for you. Also looking at some nervous system regulation tools and support. Like we said, we do tapping, we use different tools to help our clients like expand their capacity, custom supplements for what your body needs, having a movement and exercise plan that works for you. So there's a lot of different things. You can take a snapshot of this, but this is what, if you have these things, you will inevitably optimize and improve your health, guaranteed, right? And the way that I put this together in the 5-month program is the only program that I know in the market that gives you 5 health programs in one. Like I said, functional medicine, we're going to look at your body, look at functional lab work. We're going to get to the nutrition that's needed for your results. Digestion to improve your gut health. Mindset program to help with the limiting beliefs and the things that have held you back, and the detox program to make it sustainable for the long term. Like I said, just sharing, these are just some little messages that different clients have sent. I'm celebrating that I'm getting a full 7 hours of sleep consistently. The practices and tools you share have been really a game changer and helped me let go of the guilt and shame I used to feel. Hey, Amanda, I've been doing really well, lost a few more pounds. I'm so conscious of the healthy fats and the nutrients I'm putting in my body. I love my system for meals and how it fits into my life. I'm feeling fantastic. No more afternoon slumps. I'm getting my workouts in the mornings and bloating is gone. Again, it's like having this combination is such a powerful momentum shift for you. And here's what you get inside to take control of your hormone health and be in the driver's seat and feel empowered, because you understand your body and you get to design your health for your life. 5 private consults with me to create a unique plan for your body and your situation. Plus, every single week we touch base. You have a private messaging channel with me. I'm not like, hey, let's touch base and then we'll meet again in a month. It's different than doctors. It's like, this is mentorship. This is ongoing support so that you are never alone. And you have this ability to create momentum and stack wins side by side to get that momentum going. Food, nutrient, lifestyle guidance and support, plus 10 live trainings with me to ensure that you create lasting transformation. Again, we dive deeper in these categories in each of these areas so that it really inspires you and really hones in. We also do a quarterly symptom review to see your progress, because I'm all about like data as proof. It's like, we want to see actual evidence of change too. My standard is a 72% symptom improvement over the course of 5 months in our work together. So if you start where you're having headaches, where you're having insomnia, where you're having bloating and you're having joint pain and low energy, all the things, it's like a whole comprehensive symptom checklist. Those drastically change in a few months. And women all the time are telling me like, oh my gosh, I forgot that I even used to have, these skin irritations and skin rashes that would break out sometimes. I forgot that I used to feel completely scattered and I could not focus because I don't have that anymore. I forgot that I used to have to take a Tylenol every single day for all the aches and pains in my body because it's been months since I've done that. I don't have that anymore, right? Then you also have online training to understand why your health is the way it is and step-by-step roadmap. So in conjunction with our time together, I have short little training videos, like 10 to 15 minutes, so that you are learning, and worksheets that go with it. So you're learning and knowing. Actually, each client gets this little like workbook. So it's like all about like step by step, you actually put together the piece of the puzzle. I want you to leave our time together knowing so much more about your body and having so much more clarity and simplicity with what it needs and how it works. So you're a partner with your body. And the bonus is you get functional lab work credit $500 credit to use towards the testing. Like I said, the hormone testing, the micronutrient testing, so we can see where your body is. So here's what's available for you. Past clients have reported saving an average of over $30,000 in the 5 years following our work together, from different things like increased promotions. This is the average. Some have been way more than this. Increased promotions, new job opportunities, because they're showing up in a different capacity. They have different energy levels, different creativity, different impact. Savings on medications, different things that they used to do to manage their symptoms, savings on clothes and products and treatments, also medical procedures that have been avoided. So it's definitely financially, you're making the investment in your health proactively instead of reactively once something becomes a problem, right? The total value of the program, when I was healing myself, I invested it in many different tools of support. And I've taken the best of what worked and brought it together in this comprehensive solution so that you don't have to go out and find a functional doctor to run your lab work, and then find a nutritionist to give you guidance on meals, and then find an accountability coach to make sure that you actually consistently execute. That's what I did. I kind of piecemeal. I actually spent way more than this, but this is just the industry standard for what these things are now. So, it's very pricey to have this type of comprehensive support. Here's what you may experience if you join the program, the Thyroid Hormone Solution program. Like I said, there are ways to have lots of different benefits. And I want you to think about, like, what is the most exciting for you? What is it that you are most excited about? Whether it's having more energy, whether it is feeling confident and sexy and attractive in clothes again. Maybe it's experiencing deep, deep sleep and, finally feeling like what your body needs and where you're at. Maybe it's experiencing more joy, more peacefulness, more connection in your life. Thinking about what that looks like for you. And really, I guess the invitation is to take action, right? To do something different. This is your chance. And I'm going to put in here in the chat, you can apply to learn more and schedule a consultation with me to learn more about the details of the program. This is kind of an overview. But if you go to hinmanholistic.com/hormone consult, actually, let me put that in here. I'm going to put that in and make it easier for you to be able to do that. Then you can check it out and book a call. Here you go. Let me put that in the chat. If that's something you want some support and some help. So any other questions, ladies? Is there anything else that I can support you with today? Yeah, just put that in the chat. You can check out there's an application to fill out some questions so that I kind of have a sense of like where you are and what you're looking for. And then after you fill out the questions, it will take you to a time on my calendar to book a consult, an individual consult, and discuss what that, kind of where you're looking to go. And this is something that I feel absolutely confident that we can do together, and what that looks like with support. Yeah, so any other questions today that I can help you with, ladies? Alexa says yes, sounds good. All right. Well, tomorrow we wrap up our final day 4, which is a little bit more about toxicity and removing toxins to keep that total toxic threshold low. So we will kick it off again tomorrow. I'll see you back there one more day. Thank you. My pleasure. Yes, have a great one.